A new report on the health of the people in Wisconsin shows the state is doing okay overall, but moving backward in some areas. The annual America's Health Rankings report ranks Wisconsin 20th, a dramatic drop from last year's 13th place ranking. It says the state is lagging behind when it comes to issues like obesity, binge drinking, exercise, and the health of vulnerable populations. The national study noted a strong increase in the number of young children in Wisconsin getting vaccinated and a steady increase in the percentage of people engaged in physical activity. However, the number of people reporting at least one instance of binge drinking in the past month increased almost a full percentage point, and the percentage of adults who are obese grew 2%. And joining me now to talk more about this latest ranking is La Crosse County Health Director Doug Mormann. Thanks for being here, Doug.
Oh, happy to be here.
Well, let's start with the positive. This report noted that the state is doing a lot better with vaccinating its younger population. That also holds true in La Crosse County. Why is that?
I think it's because people understand how they can protect themselves and their kids from getting diseases that can be prevented by immunizations. We're doing well here in our part of the state in getting people immunized for influenza, and we're seeing that we have not had cases, so at least not too much yet this year, and we think that's really good. So it's part of people paying attention to what's happening around them and making good decisions.
Binge drinking is one area that really needs improvement. We all know La Crosse has had its struggles with this issue over the years. Are we seeing any progress here in this department locally?
You know, we're doing. I'd like to say that we're doing better. We are more knowledgeable than we used to be, but we haven't quite yet made the decisions that we as individuals need to make about making a decision to choose not to drink quite as much. Unfortunately, that is not unusual in this upper Midwest. Minnesota is having some similar difficulties, although unfortunately Wisconsin ranks first.
Is that more education that we need to be doing?
I'm not sure. There are groups of folks in our community. There's folks at the high schools, people at the two healthcare systems, people with private nonprofit organizations, health department, and others. We're trying to figure out ways to help people use the information that they have to make decisions that will keep themselves healthy. We just have a culture at the moment that suggests that drinking too much is not a bad thing, and it certainly can be and is.
Our neighbors to the west, Minnesota, they did a lot better in this report, ranked third, significantly better than Wisconsin. Why do you think that is?
I'm not sure about that either. Minnesota has had a history of being able to do a little bit better than we in terms of controlling their weight. They have a little more exercise kinds of programming. They're a little ahead of us in having streets and sidewalks and environments that people can exercise a little more than we do in Wisconsin. We are improving in Wisconsin as a state. It's just that the rest of the country is improving faster than we are. I'm hopeful that the Affordable Care Act, there's a portion of that calls for funding to cover the cost of individuals to go to see their physician, ways that they can learn ways that they can control or better manage, make better decisions to keep themselves healthier. So I'm confident that we're going to continue some progress, or the progress that we've been making, but we got more to do here in Wisconsin.
All right, Doug, thanks very much for your time and insight. Appreciate it.